With coronavirus deaths nearing 142,000 and cases approaching 4 million, you will hear people say there was a change in tone from Donald Trump today. It is true his mouth emitted different sounds and words, a change. But whether we see a change in policy, a change in action, that remains to be seen. Still, for this one moment at this one briefing today, the president, by and large, said things out loud that he rarely does.
Some areas of our country are doing very well. Others are doing less well. It will probably, unfortunately, get worse before it gets better. Something I don't like saying about things, but that's the way it is. It's what we have.
In addition to that, the president also gave his fullest, least equivocal endorsement yet of steps to slow the spread.
And we're asking everybody that when you are not able to socially distance, wear a mask, get a mask. Whether you like the mask or not, they have an impact, they'll have an effect, and we need everything we can get. We're instead asking Americans to use masks, socially distance, and employ vigorous hygiene. Wash your hands every chance you get while sheltering high-risk populations. We are imploring young Americans to avoid packed bars and other crowded indoor gatherings. Be safe and be smart.
So those words and the ones before it might just as well have been spoken by Dr. Anthony Fauci, who was conspicuously not invited. And the entire briefing can be read as something else, an unspoken admission that the president has been wrong. Wrong about his hands-off, head-in-the-sand approach to a virus that has taken nearly 142,000 American lives. That said, even as he admitted that things would get worse before they get better, he had little to say about what he would do to make them better. What he did do was issue a proclamation that sounds outlandish when you consider he's called himself a wartime president and, as we said, nearly 142,000 Americans are dead.
We are in the process of developing a strategy that's going to be very, very powerful.
In the process, it's going to be, what's the wait? We've waited for nearly 142,000 lives. He didn't really announce a plan to make testing more available so that people aren't waiting hours or days to get tested, then waiting up to 2 weeks for results to come back. Commercial labs say they're overloaded at the moment, but the president announced no federal plan to allocate unused capacity at state labs, university and hospital labs, even veterinary facilities, as one expert suggested on another network today. The president spoke of fatalities being down 75% since April. They are. However, they're up sharply in the last several weeks, as the surge of new cases became a surge of hospital patients and now a surge of fatalities. He said governors told him they have adequate hospital capacity. Well, in Florida today, ICUs at 53 hospitals are now at or above their limits. And in Arkansas, the number of people hospitalized with COVID hit a new high, with about 1 in 5 of those patients on ventilators. Texas reported 131 new fatalities. So yeah, things are getting worse. And yes, we heard the president admit it. But we also heard him say things that are not true and gloss over realities he'd rather not face, even though the country must. And hanging over all of this is the question, how long until the words spoken out loud this evening, with all the caveats attached, are replaced once again by the president we have seen and heard the other 99% of this pandemic? Remember, we have been here before.
Avoid gathering in groups of more than 10 people. Avoid discretionary travel, and avoid eating and drinking at bars, restaurants, and public food courts. If everyone makes this change or these critical changes and sacrifices now, we will rally together as one nation, and we will defeat the virus, and we're going to have a big celebration all together.
That was March 16th. We're all in this together. We're all rallied together. Well, not even 24 hours later, the president was on Twitter and on the attack. Failing Michigan governor must work harder and must be more proactive. We are pushing her to get the job done. I stand with Michigan. That was March 17th. On that date, just 131 people had died in this country. It took almost 142,000 more dead Americans for the president to once again appear to be facing reality. Perspective now from CNN political analyst and New York Times White House correspondent Maggie Haberman, also CNN chief medical correspondent Dr. Sanjay Gupta, two of the smartest humans I know, who also happen to be pretty nice. Maggie, How did the White House think it went this afternoon, and what can we expect from them? What do they want to do going forward?
John, the White House was overwhelmingly very happy with how this late afternoon briefing went by the president, with obvious exceptions, one being the Ghislaine Maxwell question, and they wish that he had answered that differently. And with all due respect to Jim, who I know is reporting on this, but I'm not convinced they didn't brief the president about this in the past, and he just messed up the question. They felt like he was saying things he needed to be saying, that he was sort of not getting outside his lane, not musing about treatments and chemicals and what we saw previously where he was sort of trying to one up the doctors, that he was talking about a forward-looking picture. That's obviously an incomplete look at it because there's a lot of questions to be asked, as you just said, and it's not clear to me that he can sustain this for a number of days. That is always the issue with him at these kinds of briefings. It starts out fine and then it starts to degenerate over time. But for today, they're happy and they plan on doing similar briefings to this, whether it's every day, what it looks like, we just don't know yet.
Yeah, they may plan it. Whether he goes along with it, we'll have to see. Sanjay, Dr. Anthony Fauci not invited. Dr. Deborah Birx left backstage, not invited out onto the stage. What would the scientists have added to this, do you think?
Well, I think there's two things. One is just having the united front, right? The scientists are talking and you get that support from the White House. I think that's important because I think a lot of times there's been this real schism between what the White House is saying and what the scientists are saying. So a lot of time it's like point counterpoint almost. So speaking with one united front would have been important. But there's a few areas that I think would have been important to talk about moving forward, as Maggie was saying. One is testing still. We've been talking about testing since March. We're still not doing enough testing. It is true the United States does more testing than other countries, but it's because we need to. It's because we have a lot more virus in this country because we wasted time really not, keeping tabs on this widespread infection in February and early March. So right now, the testing's really only used, John, to flag hotspots around the country. Here's a fire over here. Here's a fire over here. It's not used to be able to isolate and then quarantine contacts and bring down the trajectory of this pandemic. So that'd be a big one. Schools is another one. I mean, that's probably topic number one. Like, what is the real science and evidence behind whether you're going to open schools or not? Are schools going to receive extra funding in some cases as necessary to be able to implement these physical distancing guidelines, buses, staggered start schedules, all the things that are real in people's lives right now? And I'll just remind you, John, it's almost preposterous to talk about, but containment of this virus means 1 in a million cases. That'd be 350, roughly, new cases a day. That's what we should be angling for. Here's the goal. Here's the problem. Here's how we get there. That's what I would have liked to have seen.
350, and we're at 65 to 70,000. Sanjay, I am sure you were pleased to hear the president's language on masks. He said unequivocally people should wear them. Even if they're uncomfortable, you should wear them. However, less than 24 hours ago, last night, he was at an event at a Washington, D.C. hotel where he was not wearing a mask, and he was close to people who were not wearing masks, too. So, how will the message get out? What will the public see here, do you think?
I don't know, John. It's clearly a lot of whiplash for the public. I mean, it's such a seemingly simple thing to do that can make such a huge difference. So overall, I'm glad he put out that tweet yesterday with him wearing a mask. I happen to live in Georgia, John, where the governor was suing the mayor over masks. And, I'm not, as we talked about last night, I'm not a political reporter, but the idea that these governors are taking their cues from the president and the president then tweets out a picture of him wearing a mask, I think probably does make a positive difference. I don't know. I mean, I think people who are real skeptics, they'll look at that video you just showed and say, I don't have to wear a mask either. But hopefully this makes a difference in a positive direction.